Hi, I'm Krista Rogers, Nurse Care Navigator for Anna Shaw Children's Institute. I'm going to talk about grants and waivers today. So, Georgia's Supplemental Security Income for Children, or SSI, is based on parents' annual income. This is also known as Social Security Disability, and it provides a insurance coverage up to the age of 18 as long as the child continues to qualify based on the parent's income and need. If parents' income is over the SSI limit, there is another program offered by the state of Georgia called Katie Beckett Deeming Waiver that can supplement based on the child's need and not the income of the parents. This also allows a secondary insurance of Georgia Medicaid during the time that their child needs are great. So for therapy, multiple therapies, that kind of thing. The now comp waiver is for ages 18 and up in conjunction to other insurances. This program helps to cover things that are not traditionally covered by insurance. Katie Beckett Deeming Waiver provides the secondary insurance that offsets copays and deductibles for children that the parent's income is above the SSI income limit. Each child will need to requalify every 2 years since the waiver is based on the need of the child with therapies and medical visits. The Now Comp waiver provides additional money for adult needs, so ages 18 and up, that are not covered traditionally by insurance or the adult SSI disability insurance. It is required or recommended that you apply every 2 years prior to the need due to the wait list length. Who can qualify for Medicaid waivers is based on a lot of different things. So qualifications are slightly different with each waiver. It's recommended that you talk to an advocate to see what your child could potentially qualify for based on income, diagnosis, testing, and overall need. Tennessee also has a Katie Beckett program. It's a little different than Georgia's. They offer a stipend amount yearly that is approved, that you can use on approved services and items that your child may need. This is just a two-part thing, so it depends on which part your child qualifies for based on your child's diagnosis. Easter Seals of North Georgia provides financial assistance for those that cannot qualify for SSI or Katie Beckett. The grant money is just kind of proportioned out based on need, but you do have to be denied Katie Beckett and SSI to be able to qualify for this one. Eligibility is just basically having a commercial insurance, applying and being denied for the Katie Beckett. Child has to be under the age of 18, still living at home, and have physical, cognitive, or developmental disability. The Floor Covering Industry Foundation is a local grant. Anybody working within any floor covering industry can qualify for this if you've worked for them for 5 years and you qualify financially. The child does have to have a physical, cognitive, or developmental disability to qualify for this service. United Healthcare Children's Foundation provides a grant um, that is that provides medical coverage to kind of help with offset copays and deductibles. You have to have a private insurance, and parents' income does play a role in this. Eligibility is that the child has to be under the age of 16. They have to have a social security number. Primary coverage for the child has to be a commercial plan and under the care of a licensed medical professional. And then the family income must not exceed the maximum eligibility family income, which is shown here. The family support grant has a typical wait list of 1 year currently in most of the areas. It is recommended that you apply anytime. However, it is based on the child's need, and that depends on how long you'll be on the wait list. So the greater need, the higher up the wait list you are. The lower need, the lower you are on the wait list. It depends on the area that you live in, who facilitates it, and how long that specific wait list for that area is. This will give you added opportunities for therapeutic and recreational activities, respite care, and much more than just traditional insurance covers. The qualifications for family support and the links are listed here, so it depends on which county you live in or state. The top two are Georgia, and then the bottom one is the Tennessee one. It includes all of the southern part of Tennessee. Focus and Fragile is a company out of Atlanta that provides equipment grants for children, and they help with specialized equipment such as modifications to vans, strollers, seating systems, things like that insurance may not be covering. So if you don't qualify for one of the Medicaids and your primary insurance doesn't cover things like this well, they can help out through their grant program. BODAC is Friends of Disabled Adults and Children, and they accept just basic grant approvals. You can contact them, and they have numerous things that can help.